It's my proud privilege and honor to introduce this year's RC Orthopedic Excellence Awardee, Dr. Vikas Agashe. Sir, I would like to quote this paper which has recently been published, The 10 Traits of a Great Physician by John Higgins, and I would circulate it to the delegates. And what are those? Be a detective, which you are, sir. You have made a lot of investigation. You have to be an orthopedic detective to look into insights about how to treat patients. Be healthy and relax because a sound body and a sound mind is the only thing that can take a physician far. Be a master listener. The patience with which you listen to other people and then give your comments is an exemplary art which not many have. You must find your passion as you have in infections and trauma. You treat the whole patient, not only his physical disability, but also the mental disability and the family structure. Have empathy towards your patient and society at large. Pay attention to great detail. As he was telling me, he prepares the lecture every time anew, even though he has spoken on that topic multiple times. Be resilient. You are resilient in your approach towards life, and you take responsibility for most of your actions as well as your deeds and as you guide your students. And finally, count not your money, but your stars. That means your passion. So I recommend all of you read this article. It's beautiful, and all these traits apply to this year's awardee, Dr. Vikas Agashe. Born to Dr. Madhav Agashe and Shraddha Agashe, this is the young Dr. Vikas Agashe, who had his undergraduate and postgraduate training at the St. G.S. Medical College and KEM Hospital in 1969 for 4 years till 1973. Sir, incidentally, I was born in 1969. So you can see, Sir joined MBBS at that age. And his notable batchmates have been Dr. S.R. Mukhi and Dr. A.R. Karkhanis from KEM and JJ Hospital. And this is where he met his better half, Dr. Padma Karkhanis, who's a successful gynecologist. After his UG training, he did his PG training in KEM Hospital and Cooper Hospital between 1973 to 1977 and was greatly influenced by Dr. Katre and Dr. Anand Thakur, which were instrumental in his orthopedic training and upbringing. After his PG, he worked as a senior AMO in the Cooper Hospital from 1978 to 1983, where he forged lifelong friendship with people like Dr. Zawar, Dr. Kothadia, and Dr. Abhay Narvekar. Dr. Kothadia is here specially to wish him well on this occasion. After that, in 1985, Dr. Agashe started his maternity and surgical nursing home, and that is a few pictures in Kurla of his nursing home, which he is successfully running today and has handed over to his young son, Mandar Agashe. So that is a young Dr. Vikas Agashe at his hospital. He joined the PD Hinduja Hospital in 1999 and he worked for the implant registry for the Bombay Orthopedic Society and started his work on osteoarticular infections at the Hinduja Hospital. His seminal work on osteoarticular tuberculosis has formed the basis of our modern understanding and TB of osteoarticular tuberculosis in this country. He started his academic journey, which hasn't ended yet. His main hobby, as you can rightly guess, is and has been academics all the time. Forever a teacher, teaching his youngsters, colleagues, as well as seniors, and interacting with them all the time. He's one person who has always been involved with the Maharashtra Orthopedic Association, a rare trait for people coming out of Mumbai, sir, if I may, so with tongue in cheek. Delivering the Golden Jubilee Oration at IOCON in 2019 has been the highlight or the high point of his illustrious career, and it was very well received on the diagnosis and management of osteoarticular tuberculosis. A drastic change in the mindset is needed. It's not enough to just diagnose it. The other hobby Sir has is spending time with his family and grandchildren, and you can see some brilliant photos of Sir and Madam with Mandar, his wife, their son Vyom, and his daughter Sujata in Canada, and his son-in-law. He's been a study group leader for osteoarticular tuberculosis, World Association of Infection in Orthopedics and Trauma, 2021 to present. Chairman of Infection Subcommittee IOA 23, member of the Infection Subcommittee IOA 22, advisor to the Infection Subcommittee IOA 21 onwards, chairman of the Trauma Subcommittee Indian Orthopedic Association 19 and 20, Golden Jubilee Awardee IOA 2019, president of the Bombay Orthopedic Society 2011-12, vice president in 99 to 2000. He has special interest in orthopedics on metabolic bone disease, osteoporosis, infections, especially TB, trauma, and non-unions. Ladies and gentlemen, I give you the awardee for this year, Dr. Vikas Agashe.
May I request you, sir, to please take the center of the stage. We will now begin with the award ceremony. I request Dr. Parag Sancheti to honor our RC Excellent Award awardee today, Dr. Vikas Agashe, with the Puneri Pagdi. Ladies and gentlemen, the RC Excellence Award goes to Dr. Vikas Agashe 2023. Please. The Puneri Pagdi is a mark of honor and respect to a man of the highest education and professional excellence in the land of the Peshwas. I now request Dr. Sandeep Patwardhan to please honor Dr. Agashe with a traditional shawl and uparna. I request Dr. Chetan Pradhan to present Dr. Agashe with the traditional coconut signifying blessings and divinity. I call upon Mrs. Agashe to please come on stage and accompany Dr. Agashe on stage. Dr. Ashok Sham will present Dr. Agashe with a citation on behalf of RC. The citation will be read out by Dr. Parag Sancheti.
Dr. Ashok to please present the citation to Agashe sir. This citation reads, the Alumni Association of Sancheti Institute is privileged to present Dr. Vikas Agashe with the Orthopedic Excellence Award for 2023. Dr. Vikas Agashe is a skilled orthopedic surgeon with a flair for teaching. He is a trauma surgeon with a special interest in osteoarticular infections. He has been instrumental in carrying out exemplary original research on bone tuberculosis, and he has given us guidelines for its effective management. He is a great teacher and has conducted numerous seminars and webinars and taught many young orthopedic surgeons with great passion and still continues to do so. He has numerous papers and publications in peer-reviewed journals over the years. He has been a faculty in various national and international meetings, and he has talks which are crystal clear and informative for the delegates. Dr. Agashe has managed a perfect work-life balance, and you can see Mrs. Agashe is here smiling in spite of Dr. Agashe's busy schedules. He has a perfect work-life balance, efficiently managing his corporate practice and private nursing home and helping his wife's clinical practice too. He has been a loving father to his daughter Sujata, who settled in Canada, and son Mandar, who is a successful pediatric orthopedic surgeon in Mumbai. The Alumni Association of Sancheti Institute would like to honor Dr. Vikas Agashe at the Pune Trauma Operative Course held in Pune on 4th March 2023 for being a role model and achieving excellence in orthopedics. With this, we present him this citation and the trophy.
Please rise in your seats, ladies and gentlemen, as you give him a big round of applause. The RC Excellence Award 2023 is given to Dr. Vikas Agashe by our patron, Dr. Kantilal Hasima Sancheti. Ladies and gentlemen, please be seated. Our founder and patron, Dr. KHS, sir, will now give us a short address with words of advice, encouragement, and inspiration.
Dr. Agashe, Dr. Mrs. Agashe, then Dr. Patwardhan, Vegas, and other members on the stage and their friends. It is always a pleasure, more pleasure, to felicitate someone whom you know for last 40 years or so. They did his MS, MBBS and MS from KU Hospital, Bombay, and I also did MS Orthopaedic from KU Hospital, Bombay. One thing I want to tell you about him, even after he started practice, he used to come for the clinic of Dr. Baudekar and Dr. Tawekar, and very meticulously he will receive the case, discuss it, and he was not afraid of anybody, any teacher, to ask any question. Some people are there. They say, how can I ask this question? Listen. He was open-hearted, and because of that, he has proved to be a best teacher, and he has taught so many students which are practicing all over India as well. His academic pursuit into by Dr. Patwardhan, and remarkable your achievement. But for his achievement, Mrs. Agashe, a gynecologist, is also equally contributing to this. Because, somebody was telling me, behind every successful man, there is a woman. But somebody today morning told me, there is a woman to rectify his mistakes. Anyway, thank you very much. And I really congratulate you. I am glad one of my good friends is getting this Lifetime Achievement Award. Madam Sulipana is a good Anandawat.
Thank you very much, sir, for that wonderful address. I request Dr. Agashe, sir. This is the moment we have all been waiting for. I request him to please share with us his feelings as he receives this award and trophy and tell us about his journey in life and how he reached this coveted position today.
Mr. Convener, sir, Dr. Arjun, respected Dr. Sancheti, sir, all the chairpersons and all of you for being here. I sincerely thank all of you here. I sincerely thank Sancheti Association for this great honor. This just strengthens my belief that I'm an extremely lucky person. Friends, you will not believe that 1966, I was in Pune, and there was a front page news in newspaper. Chief Minister VP Naik was injured in a helicopter crash, and Dr. Sancheti sir had treated him, and that had made headlines in Pune paper. And actually, since then, sir, I've been following him. Since then, even before I joined medicine, I have been following him since my 10th standard. Possibly because I was destined to be honored by ASSI one day. Ladies and gentlemen, it's my great honor to present AASI Ortho Excellence Oration. In short, I was told by the organizers, the Jindagi ki kitab khol ke batao, what went well and what I would do differently next time. Before starting, I would like to acknowledge my pillars, Dr. Chauber, Dr. Katre, Dr. Tanna, Dr. Lad, Dr. Thakur, Dr. CJ Thakkar, Sushil Sabnis, Sanjay Fatke, Sanjay Agarwala, Vivek Shetty, Hemant Patankar, Mandar Agashe, Abhay Narvekar, Aditya Menon, Ram Prabhu, Shekhar Bhojaraj, Abhay Nene, Samir Dalvi, my plastic surgery friends, Hitaram Prasad, Vimal Modi, Dati, and many more. And last but not the least, my family. I also acknowledge the industry support for various symposia and workshops that I have conducted. Friends, the journey has been exciting. Here you can see my 82 photo with Dr. Thakur in the center, Dr. Pradeep Kothadia, Dr. Sauji, Dr. Sapnis, Didi Shah, and many more. To now, 2023. Friends, I was born in a middle class, disciplined, but not very strict family. My father was a general practitioner, and every week he would quote Thomas Alva Edison. Genius is 1% inspiration and 99% perspiration. Week after week, he would say that. My mother was a housewife turned nurse, and she has guided me all along, even when she is not alive. Her mantra was, if somebody does better than you, appreciate the talent and hard work of that person. Do not be envious of it. And that has helped me all through my life. Friends, whenever I have strayed, whenever I have not followed advice of my parents, I have had a setback. 1969, I entered GS Medical College. And within 2 years, I forgot what my father had told. I spent time playing cards, gambling, and the result was obvious. Final MBBS marks, I did not get good marks in final MBBS. I had to take up orthopedics because those days, orthopedics was the last branch taken. Hardly any demand. So I could just about enter in orthopedics. And I did not even get a good recognized post. I got an unrecognized post at Cooper, while most of my friends were in KM. I was extremely depressed, but Dr. Thakur and Dr. Katre encouraged me all along. And I said, let me fight hard now. The next post was in KM. Dr. R.S. Thir was my teacher. And those days, when there was a wave of rigid fixation, you would talk of respecting soft tissues. So possibly AO took over from him the respect to soft tissues. There are many giants in KM like Dr. Baudekar, Dr. Vansali, Dr. Ellen Mora, Dr. C.G. Pradhan, Dr. Bhandare, and Dr. M.N. Shane. And all of them were instrumental in teaching me. October 1976, I topped the Ortho exam with Dr. Vansali and Dr. Tanna as examiners. Those days, Dr. Tanna was considered a terror examiner, and I was extremely satisfied with myself and my performance. Little did I know this quote. Show me a thoroughly satisfied man, and I'll show you a failure. The result, I failed in my MS exam. So, 1978-79, God gave me a lesson, but God gave me a gift. In my second attempt, an elderly gentleman started attending clinics and surprisingly was extremely well read. Little did I know that he'll be my friend and guide all my life. Friends, the ageless Dr. G.S. Kulkarni appeared for MS Ortho with me and we passed out together. 81-82, I started orthopedic practice with my wife, Uma, in our 100-year-old building, which we renovated over a period of time and started a 20-bedded nursing home with tremendous financial support from many of my friends. 1985, Dr. Thakur and myself started studying implants, and these are the photographs on profile projector where in Polytechnic as well as IIT, where we studied, you can see some defective screws, and that is what we did for quite some time. My first teaching assignment or workshop was in 1988 at Indore with Orthosis Company. The other faculty members were Dr. Thakur, and late Dr. Joy Patel. It was an absolute disaster for me. I overheard a person asking the secretary, "Arey kidhar se utha ke laya?" But the other faculty members said, failure is not opposite of success. It's a part of success. So further workshops continued. It used to be extremely challenging for me those days. But as Chandru always still used to tell me, challenge and opportunity go hand in hand. And with every workshop, I got better and better opportunity. And as I started my journey of academic activities, a new vista for being on the dais, improving thought process, and getting involved in multi-specialty management. I got an opening at Hinduja Hospital. The real defining moment came in 2003. I had operated a patient of ankle synovitis. I had done a frozen section which turned out to be tuberculosis. So the patient asked me, "Sir, I hope you have sent TB cultures." So I said, "TB cultures? I have done frozen section and it has proved to be COX." And I said, "Cultures are almost always negative." The patient said, "I beg your pardon, sir. You should have sent my cultures. What will happen if I'm resistant to one of the drugs?" That really gave me a clue. Those days, clinico-radiological diagnosis was a norm. Even WHO used to say that in endemic regions, the diagnosis is clinico-radiological. Even as late as 2019, the IGO paper mentions that most of the patients were diagnosed by clinico-radiological imaging, including MRI. So it set a chain of events. I did a pilot survey in BOS members, wanted to find out how many of them are actually doing cultures. So it was only Dr. Gujraj and Dr. Nene who were doing cultures on a regular basis. But almost everybody said that some patients, a fair number, are not doing well. There is something wrong going on. And our think tank, Dr. Camilla Rotex, who is a microbiologist, and Dr. V.R. Joshi was director of research. Camilla said this could be resistance. You need to unmask it. How do we know that it is resistant? You must improve your yield by whatever means. And Dr. V.R. Joshi said, if at all you want to do a study, do a pan-India study, pan-Mumbai study. So with their help, I planned and submitted a research project to Research Society with a hypothesis that whosoever is being given or initiated on anti-TB drugs may not have, and all those who have TB may not have drug sensitivity. The key is sample. So collection, container, transport, and test have to be told to all the members so that they do an appropriate job. Friends, what happened next reminded me what I had read in school by Pandit Madan Mohan Malviya. दुनिया में देने वालों की कमी नहीं है, कमी है उन हाथों की जो उन्हें स्वीकार कर सके. With first meeting of Research Society, they sanctioned a handsome sum of almost 7 lakhs 20 years ago. They encouraged me all along. So we involved BOS members, put a lot of stress on giving clinical details and appropriate sample, or we said send patients to Hinduja and we will do all the tests totally free. So the first project was in 2004-2007. 38 surgeons contributed and we studied 93 patients. Patients who were about to be started on ATT or were already on ATT and not responding. Friends, out of 93, 12 did not have tuberculosis. They were just being given anti-TB drugs. And there were 15 cases of resistance, and that is why they were not responding. And this we published in as a paper in Osteoarticular Tuberculosis, Diagnostic Solutions in a Disease and Limitation. Also paved way to another publication by Nene, Kunnani, myself and Pawar on multi-drug resistant tuberculosis of spine, basically beginning of May. This was followed by another project. And again, the money just came in. Bombay Orthopaedic Society gave 13 lakhs and a senior orthopedic surgeon contributed another 1 lakh. The idea was to find out why patients do not respond to anti-TB drugs in spite of clinico-radiological and maybe histopathological diagnosis. 89 patients enrolled from all over Mumbai. They were all on ATT. And 16 out of those 89 were resistant, did not have TB. 1/3 were resistant to at least one drug, 24 MDR and 3 XDR. So, friends, this is the situation in our country, and that is the biggest challenge. So, the prevailing idea that diagnosis of osteoarticular tuberculosis is clinico-radiological cannot be accepted. There cannot be any empirical initiation or modification of ATT as opposed to established concepts. So in short, we converted uncultured Mumbai into partially cultured Mumbai. And I was fortunate to get IOA Golden Jubilee Oration Award in 2019. So I must thank microbiologists, our ID specialists, the TB team, and my smart fellows, students, who are all eminent surgeons now. So we started publishing in national and international journals, mainly about infections and metabolic disease. So this is the Golden Jubilee Award paper. Then I was invited to write a review article by World Association Against Infection in Orthopedic Trauma. And what we realized was, yes, in our country, we miss out on resistance, but in non-endemic countries, they miss out totally on TB because they just don't know what is osteoarticularity. With Manish Agarwal was another publication, TB simulating tumors. Friends, the most challenging infections all over the world today are carbapenem-resistant gram-negative infections. And we published our experience of 26 cases over 30 years with a decent survival rate by modifying some management protocols. In all over the world, there are three common things, three main infections which are challenging. The non-tubercular mycobacterial lesions, which we published in ISO, infections in Burkholderia pseudomyeli, which is becoming a distinct threat in our country, as well as fungal osteomyelitis, which is a challenge all over the world. We also published on some very uncommon infections, discharge after stimulant, and another common metabolic condition, which is often missed, tumor-induced osteomalacia. Patients keep getting hypophosphatemia, osteomalacia for years together till they are diagnosed having a tumor. And the moment you excise that tumor, they settle. Some more things that went off well. I got an opportunity to speak at every TraumaCon, and that was an excellent learning experience. IOA, Dr. Rajesh Malhotra, appointed me as chairman of IOA part, and we started IO Pathshala. Subsequent IO presidents, Dr. Meena, Dr. Shiv Shankar, who is here, and Dr. Ramesh Sen, supported me tremendously. And with encouragement of Dr. Atul Srivastava, I've initiated an initiative called Defeat the Demon, addressing infections as well as antimicrobial resistance. COVID impact helped OrthoTV team, and with help of OrthoTV, we did several webinars, courses, and online fellowships. Events which troubled me but possibly were helpful was friendship with illnesses. I was a very stable polio since childhood. 30 years after stable polio, I started getting pain, involuntary movements, muscle weakness, which today is known as post-polio muscle ache. I had severe carpometacarpal arthritis of thumb and had to undergo surgery. I tore lateral collateral ligament followed by additional rupture of peroneus longus, and I had to wear an ankle foot also, which is still bad. 2016 had a myocardial infarct for which I had to undergo rescue angioplasty followed by CAVC. 2019 I had bilateral rotator cuff tear, the right needed arthroscopic repair. And 2019 again, I have a painful irreducible hernia through bypass scar, which needed laparoscopic repair. And friends, I'm here standing in front of you entirely because of these people, Dr. C.K. Ponde, Hemant Patankar, Sudhir Warrior, Kaushal Pandey, Deepraj Bhandarkar, and Abhay Nadi. I owe all, everything to them. So these illnesses have been a blessing in disguise. I can relate well with patients' perceptions. I also got time for introspection and rest. Friends, anything that doesn't kill you makes you strong. Remember that. Finally, what went well? Most of my life, I could follow my mother and father's advice. I started my journey thinking that I have no godfather. Now I'm astonished to have so many godfathers. Friends, actually, I've yet to come across one single person who tried to pull or push me down. Everybody that I have met has always done. Lastly, what will I do different? Now, I may have to speak for 2 days, but I will just tell you 2 or 3 things. First and foremost, I control my tongue. My anger harms me more than the wrong. I will also follow the policy of forgive and forget and not keep fretting about the thing. Lastly, I should improve proficiency in languages, especially in English. So finally, what are the tips for youngsters? First is my tip. Include 2 new tests in your armamentarium, history and examination. Before doing any investigations, please carry out these 2 new tests. Second, follow Dr. Tanna sir, Dr. G.S. Kulkarni sir, and Dr. Babulkar sir. Remain a student all your life. Last but not the least, follow Dr. Sancheti sir. In spite of getting so many honors, he has followed the following code all along. It is very nice to be important, but more important to be nice. Hats off, sir.
Ladies and gentlemen, please put your hands together and rise in your seats to honor this exceptional and phenomenal human being. A round loud of round. Thank you so much, Dr. Agashe, sir, for your very inspiring and motivational words and for sharing with us the lessons we have learned over the years. We will do our best to follow your suggestions and guidance.